Welcome to the second part of IPOPI's mini documentary on autoinflammatory and rheumatology manifestations in primary immunodeficiency patients. We have with us Samantha from the Netherlands. She is diagnosed with common variable immunodeficiency, so CVID for short, but she also has autoinflammatory manifestations. Samantha, what were the initial symptoms you experienced?
I was very tired for a long time. So, yes, tired, and that's where it all began. With my, later with my lungs, but in the beginning it was my, I couldn't sleep all day.
Then it became known that you have granulomas in your lungs. How was the diagnosis done?
I couldn't see it from an X-ray photo. I have seen the photos. It was all white, my lungs.
And what treatment were you then put on?
I had oxygen all day and night.
And in terms of the medication, do you take any tablets?
Antibiotica and prednisone and a lot of other medicines.
Samantha, what treatment are you taking for CVID and how is it administered?
I get immunoglobulins, I get the first 2 years at the hospital, and then I had home care, and that's at the year 2012. So I think now in total I get that 10 years. And she comes to my house every 4 weeks that I get the immunoglobulins through IV.
Has the COVID-19 pandemic had any impact on your treatment?
It was all the same. My home care come and I go to the hospital if I need, so everything goes on for me.
You are a very positive person. Do you feel like you've accepted the limitations imposed by your condition very well?
I am sick since I was a child, so I'm used to it. I accept it, not always, but the last years I accept it because it is what it is, and I have good help from my family and the doctors. So yeah, I'm positive about it.
Thank you, Samantha. We also have Bart with us. Bart is an XLA or X-linked agammaglobulinemia patient who experiences autoinflammatory issues, especially in the bowels. Bart, what were the early issues you had and what was the treatment approach?
My inflammatory symptoms consisted of heavy abdominal pain in my intestine area, combined with a very long delay in going to the toilet and just not having any appetite or just have very low energy. And in treatment, we eventually came out to surgery. They had to remove quite a substantial amount of smaller intestine because, well, it was way beyond repair. And after a bit of trial and error, we came onto prednisolone, and that seemed to stabilize it. But because of the risks and we kind of didn't want to go on that path forever. And right now we're on tiagoniine, and that's been working pretty steadily so far. And we're keeping a close eye on any developments that are coming up ahead.
Would you also like to tell us what treatment you take for your XLA?
At the moment, I'm luckily having my medications from home with a very kind and funny nurse. And we're on 40 milligrams of immunoglobulins. And well, everything's going pretty stable on that front.
Has there been any changes due to the pandemic?
No, there's no issues. Of course, the nurse comes in, wears a mask, make sure to whatever he touched cleans afterwards, and make sure that everything stays as far away as possible. Other than really the hospital visits, which have been more via phone rather than in person, everything stayed relatively the same.
What is the thing that you value the most with regards to your medical care?
I really value that there is a constant of being constantly updated where needed by a very friendly and patient doctor. He seems to really be attentive to what I need, what has to be done, and that's been really wonderful so far.
Would you like to leave a message to the physicians watching us?
I would like to say to every doctor that I noticed that when a doctor tends to see me more as a person and less as a patient, I really have been telling more about whatever's wrong with me, but also what's good with me. And I think I can't speak for Dr. Dalm, of course, but I really think that it makes his job a little bit easier because we have such a bond that he doesn't have to really pry into my life on what's going well or what's going wrong. And at the same time, I don't feel any pressure to hold something back because I might be judged or whatever. And it's like we're solving a puzzle together. So whenever I'm at the hospital, I can say my mind, and he works with it and tells his mind, and together we really seem to be keeping me healthy and well.
Thank you, Bart, for the great message. Our last guest is Dr. Virgil Dalm. Dr. Dalm is an internist clinical immunologist at the PID Center of Erasmus MC in Rotterdam. He is also the attending physician for both Samantha and Bart. Dr. Dalm, what are the mechanisms behind these autoinflammatory manifestations?
Yeah, so that's a very intriguing question because it's still not really clear what kind of mechanisms are all involved in the development of autoinflammatory complications. We know that several factors may be involved, like for instance genetic variants. So we know that patients with specific genetic variants in specific genes may have an increased risk of the development of autoinflammatory conditions. We partly know which cells are involved in development of autoinflammatory conditions, like for instance in patients with common variable immunodeficiency, we see a clear disturbance in the B cell phenotypes in patients with, like for instance, granulomatous complications, and in patients with X-linked agammaglobulinemia. We know that this defect in BTK gene may not only influence the B cells that are responsible for antibody production, but this BTK gene is also involved in other cells which are involved in autoinflammation. So I think it's genetic variants that are involved, specific other cells than the B cells, and specific B cell subsets may be involved. But to be honest, not everything is known until now.
What treatment is available for these patients?
Yeah, so the treatment of patients with autoinflammatory conditions and also autoimmune conditions in primary immunodeficiencies is of course very difficult because on one side you have the immunodeficiency, which gives of course an increased risk of infections. On the other side of the spectrum you have autoimmunity and autoinflammatory complications, and in general we tend to treat those patients with autoimmune disease or autoinflammatory conditions with immunosuppressants. So medication that indeed dampens your autoimmune features. So treating those patients with immunosuppressants also gives an increased risk of infectious complications on the other side. So it's very complicated to treat those patients, but in general, autoimmune complications, autoinflammatory conditions need to be treated with immunosuppressants. So like, for instance, very largely and well-known prednisone or methotrexate, azathioprine, or rituximab, all kinds of immunosuppressants that need to be used for autoinflammatory autoimmune complications, but taking into account that the use of these drugs may result in increased risk of infections. So that's always something you take into consideration.
It's not without risk for the patient, certainly.
So, yeah, so it's really personalized treatment. So you really have to look after what you are doing, because using immunosuppressants for autoimmune complications may give problems on the other side, increased risk of infection. So you should really be aware of that issue.
How important are reference centers such as Erasmus MC for patients like Samantha and Bart?
The importance of established centers of expertise or reference centers is in the fact that you have their teams available, multidisciplinary teams, not only involving immunologists, but also involving specialists from other specialties. Because we know that patients with immunodeficiencies have pulmonary complications, gastrointestinal tract complications. So indeed, you need centers in which expertise and experience is all gathered and collected in one multidisciplinary team.
In a broader sense now, the ERNs or European reference networks, they are improving the connections between reference centers, such as Erasmus MC, which is part of ERN RITA. ERN RITA's mission is to improve the clinical care for people with rare immunodeficiencies, autoinflammatory and autoimmune disorders. How impactful do you think the ERNs can be for patients?
I think it's one of the important things is that there is access for other healthcare providers to discuss difficult cases with centers of expertise within Europe. So the establishment of this European Reference Network RITA provides healthcare workers or healthcare professionals from other European centers to bring up cases, difficult cases, in a web-based tool that can be discussed with other experts. So I think that access to expertise around Europe may improve healthcare for patients in specific centers.
Thank you, Dr. Dalm.